Hey everyone, my name is Isaac Cujo. I am so honored to get to kick us off for the Social Change Fellow Symposium. Can we go to the next slide, please? So we have amazing. We agreed that we would allow them to introduce themselves because we believe that people do a better job of telling us their story. And so we have four different presentations that you all will see the amazing work that they've put in over the past year and a half, and see amazing work that's gone into their studies, fascinating studies, and I'm excited to hear more from them as well. Next slide, please. So as you all hopefully know, I'm director of the Center for Social Change with Molly Raymond is the associate director, and you can go to the next slide. We are a connective hub, and I think Molly and I like to say that we are all things social change in terms of supporting projects, supporting ideas, being their glimpse of that. And so a host and thought leadership is a big priority for us, but moments like this where we get to elevate other people in our community's amazing work, especially social change and action through academic, is a tremendous opportunity for us. So really excited to be here. Next slide, please. If any of you want to contact the Center for Social Change, just reach out to our Social Change Center at mail.walden.edu or visit our website at centersocialchange.walden.edu, or just email myself or Molly and we'll love to connect with you. Next slide, please.
But not change gears, because the next team is also looking at research related to the pandemic and how the pandemic may be affecting mortality itself. So, Sri, I'm going to give you the ball.
Thank you. Thanks for having us. I think first of all, we're going to start off by Dr. Zeroni. Would you like to start us off and then go from there?
Certainly, thanks. I'd like to just introduce.
If you can uncover your camera, then we'd be able to see you. Beautiful. Thank you.
Well, I'm not sure if that'll help or the presentation at all, but here I am. Thank you. I'd like to begin by introducing our team. Welcome, thanks for being here. As we follow three outstanding studies, I like to think of ourselves as last but not least. Our research on theoretical and empirical connections between physical and mental health among US adults in a pandemic era began. I was fortunate enough to become a part of this. Several years ago, I lived and worked in one of the poorest areas in the country in Appalachia, and had the opportunity to, a town just north of me, right near Burr Oak, for example, near Athens, Ohio, at the time didn't even have cell phone service, nor did they have cable TV or internet. And this isn't that long ago. So being able to participate in this, where we studied things like food deserts and the like, is a great opportunity. So I'm glad to be here also. I'd like to introduce our team without further delay, a team I've had the privilege to have worked with over the last year or so. And of course, our team leader and principal investigator, Dr. Sri Banerjee. To begin, Mariangeli Sierra, next slide, please. To begin with, Mariangeli Sierra holds a master's degree in counseling and is in private practice. She's a doc student here in our CES program, Counselor Education and Supervision. Her qualitative dissertation study focuses on minoritized students' lived experience as they're working with faculty in CES programs. Mariangeli is a clinician, like I mentioned, in private practice, supporting the Latino and LGBTQIA plus communities, and is a contributing faculty here as well in our master's level School of Counseling, where she teaches intro to mental health counseling and multicultural counseling courses. By the way, she's well respected by peers and students, I might add. Our other illustrious graduate student working with us throughout this whole project, we've had the privilege of working with a doc student in the public health program, John Huth, who holds master's degrees in both molecular biology and in wildlife ecology. He's currently focusing in epidemiology. He worked for the US Geological Survey and spent time at the Charles Darwin Foundation, conducted studies around the Earth, including in Ecuador. He's a specialist in geospatial research, and interestingly enough, is a professional cyclist, was actually involved in the major bicycle race that takes place in Spain, the La Vuelta, and many other bike races around the country. And that leads us to our principal investigator, Dr. Sri Banerjee, who is a medical doctor, holds a PhD and a master's degree, has nearly 20 years experience in the areas of public health and global health. Dr. Banerjee has worked at the Centers for Disease Control and at Johns Hopkins in the area of infectious diseases and has worked on public health projects worldwide. Additionally, he's conducted award-winning research in the areas of HIV and chronic disease and has experience writing grants as is shown in this one that we've been working on. His experience as a public health consultant and serving on the board of directors of public health organizations helps providing practical frontline perspective to the learning of public health. Also, he has experience in advising students about public health projects, being a teacher in a PhD program. He has also co-authored and published more than 50 research articles, many of them in prestigious journals such as Lancet and JAMA, the Journal of the American Medical Association. And more recently, his research has received widespread attention from prominent media outlets such as Yahoo, Healthline, Health Digest, MSN Health News, and more recently, an article in MedRx IV. He uses medical and clinical experience, his research acumen to guide his studies. So it's been a privilege to work with this wonderful group. Next slide, please. In general, COVID, as many of us well know, is poised to remain a major health problem worldwide. It's led to considerably higher healthcare costs and has had and will continue to have dramatic effect on much of what we do in work, recreation, relationships, in the community, and has a profound effect on the social aspects of well-being. Without further ado, I'd like to turn this over to Dr. Banerjee. We're going to discuss the two arms of our study, the quantitative and the qualitative side. I'll be following Dr. Banerjee, talking a little bit about the qualitative results. And so, Dr. Banerjee, would you like to pick it up from here? Next slide, please.
Thank you, Dr. Zeroni. Thank you for providing the context and overview for this project. And I start with a solemn tone because COVID-19, this has been a very serious pandemic. It's devastated and really has devastated and cost many lives. I've had loved ones that I've lost. And I know many of you that are watching this, presentation, have gone through some very, very difficult experiences. And it just affected all walks of life, whether it was, your personal health, economically, just all throughout. And the sad truth is that with variants and everything, there's still more that we need to do. So when we got started we actually, conceived of this idea, of course, in 2020, and we were thinking about, what are ways that we can try to do more, and Dr. Z and I, we used to converse, talk about these things. And it was very difficult to at that time, honestly. I mean, right now we know more. We know more about the physiology. We know more about transmission relatively. I mean, with the original variant, with the original strain. So at that point, we didn't really know much, and so we were trying to understand, best ways that we could pool our resources together and just collectively determine what is a way to deal with this global pandemic. So again, it was a major public health problem. But I go further and say this was beyond public health. This was something that all disciplines had to come together worldwide, globally, and determine solutions for, and real world solutions. And so this is where we started to have some creative ideas, and of course the process of ideation. And one of the things that I want to do, we want to do in this presentation is not only give you kind of the findings, but also try to provide you with an appreciation of the process that we used. And if some of you follow some of my LinkedIn posts, I provide updates, interviews pertaining to COVID pandemic, things like that. I provide updates on there. So even with the research, as we were presenting this and providing findings, I was documenting that in LinkedIn. So all of those posts can be found, and also some of the resources. There was so much. 1.5 years worth of material. So there's actually a website as well where a lot more of this has been explained. It's beyond the scope of the limited time that we have here, but we're going to try to do as much as we can to try to explain as much of this. It's also has in fact disproportionately affected, people of color, especially Black Americans. And so minorities and especially communities of color, there needed to be more resources, more understanding to how to better address these issues. So the final part of this, and this is where we decided that Dr. Zia and I decided we needed to um, join our knowledge, and before I continue, I want to say, Dr. Zeroni brings with him a lot of expertise and a lot of talent, and was able to tap into some of that. And he has experiences in managing clinical practices. He actually managed a private practice for several years. He has held several faculty positions, and currently he's in the clinical mental health counseling program at Walden University. He's a core faculty member. So I wanted to take a brief moment to introduce Dr. Zeroni. And so he has wide expertise in the areas of neuropsychology, rehabilitation medicine. And in fact, we provided a letter to the United States Department of Health and Human Services appealing for better objectives for rehabilitation medicine. So some of his expertise in wide areas we were able to tap into in completing this project. So this has really been a joint venture, and throughout this process, not only has this been a kind of inquisitive sort of a journey, a journey towards answers, but also I found that I have a wonderful support group throughout this process, and that's what really has been important. So next slide, please. So, importantly, of course, this is where, mental health, we were trying to understand where mental health fits into this whole equation. And we're going to, as we develop this, explain where that fits in. But before, let's try to go through these. And Dr. Zeroni, if you wanted to go over some of these as well, maybe kind of explain the pandemic era, right? Understanding of
Yes.
the.
Yeah, thank you, Dr. Sri. Certainly, we won't bore you with the every detail here. This information is available, but this whole thing started when the SARS-CoV-2, which of course is a respiratory syndrome, severe acute respiratory syndrome, was first recognized in Wuhan province, resulting in shortness of breath, fever, and who informed us of an unknown etiology on this. And it
Right.
continued to take lives. Next slide, please. Reaching
And I wanted to add, we
go
were
ahead.
discussing, yeah, no, we were talking about these things, and a lot of this, it was interesting because a lot of the original deaths that were in the west coast of the United States, a lot of that was pneumonia of unknown origin. The definition and the case definition of the actual disease wasn't even known yet. And so the defining process even was just interesting. And so, Dr. Zeroni, didn't we initially look at the topic of loneliness? Isn't that the first thing?
Yeah, I think that was one of the first things we talked about. And then it morphed into discussions of anxiety and depression, which of course are often correlated. Briefly to summarize this last slide, deaths continue to rise, in my humble opinion, just through extrapolation and from knowledgeable researchers. Johns Hopkins, CDC, and others are predicting that the numbers are underrepresented. We have underrepresented the number of deaths. We passed 800,000 US deaths alone in 2021. And allow me to conclude by reading the latest statistics from Johns Hopkins University on this. Global deaths exceeded 5,500,000. US deaths recently exceeded 847,700 souls lost to this. And again, I believe these are underrepresented. So unless you had something else on this slide, Dr. Banerjee, maybe next slide.
I think one last thing I wanted to leave you with is the idea that we are grappling with new realities. With the new year, and some of you might have followed my post, but I posted about this as well, and so this was actually an opportunity for me to share some of the knowledge with Healthline, and so I was actually interviewed by the likes of Dr. Amesha Jala in providing some of that information, and part of our social change is to make sure that the information out there, what we are receiving, is what we are projecting out there. So that's kind of part of this, and unfortunately, when it's a matter of life or death, some of this information is even more important. So next slide, please.
And of course, Sri, to that point though, it's also real important, as we're seeing, when there are mixed messages or
Yeah.
perceived mixed messages coming from public health officials, that
Yeah.
we don't open the door to wild misinformation that flies around as well, right? I see that you're going to anxiety. One of the anxieties I have is people obviously don't trust our public health people anymore. Many of them don't.
Very good point, Will. That's a very good point, and some of this actually, was interesting, because some of this was particularly specifically geared towards understanding how that information translates. Because actually, this slide informs that point that you just made, Will. It's what specifically is your reaction to reading information? Have you ever considered, thinking just thinking about opening up a headline, right? Looking at the headline and taking a moment to thinking about the effect that is happening on your physiology, right? And that effect is what this scale, specific effect is what this scale was trying to measure, these 5 questions. If you think about, if you listen to the news with your ear, auditory, that's your senses. When you hear that, what's the effect? What's the physiological effect? Your fight or flight is going off. What is it that you're feeling? And I urge you to try this exercise. To try to see, is it something that you are experiencing? It's really important to assess. So, these are questions that we asked each our respondents, and we were actually under discussion. What would be the best anxiety skill, right, Dr. Z? I mean, there's so many.
Yeah, I might add that our qualitative research results bear out much of what we're talking about now. Many of the responses in the open-ended question and the 3 qualitative questions that we added to our survey bear much of this out. There is a lot of misinformation out there, and getting to the right information, dealing with the anxiety was one of the most common factors that we found when we analyzed the data themes.
Yeah, and I also just wanted to quickly add that this scale, this coronavirus anxiety scale, is actually freely available online. There's an MD calculator which you can actually input your responses and then see where your score lies. And so there was it's previously validated. It's been so. It was found that in this scale, if you were to add up all the numbers, if you were to get a score that is greater than or equal to 9, then that was found to be indicative of pathological anxiety. So this was something, a little bit of nervousness, of course, everyone experiences stage fright, things like that. But when it becomes something that is pervasive, something, so this is where this was important. So, a couple of points here. Even the process of selecting an adequate scale in primary data collection, this in itself
that was a challenge.
Can be a process.
Yeah.
So yeah. Okay, so again, we've been talking about these things already a lot, and I think it's really important to emphasize some of these things. But the fact is that people that have mental health disorders in general, that affects longevity. It's a fact that there are association studies that are showing these. So it's really important to understand a mental illness, not only in the context of general, mental illness, but specifically as it pertains to emergencies, medical emergencies, and as it pertains to mental health. It's really important to have, for instance, coronavirus anxiety scale. Specific to coronavirus, what are you feeling? The prevalence of depression, that's 350 million worldwide. Within the United States specifically, depression was estimated to affect more than 5% of adults. What is really important to understand about depression and anxiety, one thing that was, I think, a point that was brought up, Dr. Z brought up about COVID, is that there was so much, underdiagnosis, right? Well, as it happens, as it turns out, even mental health, depression, anxiety, these are underdiagnosed, heavily underdiagnosed within the general population. So awareness, not only awareness, but also measures that are conveniently created, like the one I have, the one we're sharing with you, is really important for screening. Um, so during the same time, 28% of adults with depressive symptoms went undiagnosed or untreated, and the reason being is because they didn't really have a proper diagnosis. So it's an issue. It's really an issue, and we needed to really uh, 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 take steps to understand this better. Next slide, please. Okay, so just wrapping up specifically, with March 2020 onward, and we did our own sort of analysis a little bit to see this, looking at some of these trends. March 2020 onwards, there was a prevalence of anxiety and depression that increased, and so periods when the highest rates of mental distress were reported correlated with periods of intensifying COVID-19 deaths. So with the confinement measures. So with our own research, actually, what we were doing is initially, Dr. Zeroni, remember we looked at loneliness, right, in the Google search, to see
Oh,
the see if that, yeah, yeah. Um, and didn't we see an uptick in search patterns in Google
yes,
with certain words?
significant. Yes. And I recall that at the very beginning of the study, before we even completed the survey design or the study design, just doing some preliminary data mining. And I might add, one of the most interesting factors related to that, if you go back probably to the late 1800s, when I studied all this, was the Holmes and Rahe stress scale. And that people with mental health issues, existing mental health issues, according to Holmes and Rahe anyway, and many studies that have followed, it's additive. It's not just parallel. It's not that if you have a condition of anxiety, this increased it. From the research that we saw, it appeared to increase.
Yeah, that's definitely really really important point, because a lot of these effects maybe individually may not have as important an effect, but when you start amassing and accumulating, and not only accumulating but also kind of layering effect after effect, then these start to have these types of longevity affecting longevity types of effect. So across countries, even when if we looked globally, the mental health of unemployed people, and those experiencing COVID, or those experiencing financial insecurity. So unemployment and financial insecurity made things a lot worse. So even in the Walden community, we were trying to grapple with this, and I remember a lot of in the weekly meetings and everything, in my department even. With my program director, we used to have kind of weekly conversations about this, and just how to deal with this. It's just something that has taken a long-term toll. So moving forward, to the next slide.
So Shri, we have just a few more minutes and then we're going to take questions.
Okay. So the main gaps in the literature, and I'm going to just quickly go through these. These were the areas that we were wanting to look at. Mental health versus geographic region, food insecurity. So it's just some of the broad areas, and we could just continue onward. And then I think we could probably move to the next slide so that we can go over some of the findings. Again, COVID-19 is a major public health problem, and so it disproportionately affects people of color and mental health disorders. And so moving forward, next slide, please. So in I think we could probably Dr. Zeroni.
Yeah, this slide and this stuff's available, of course. We've got just a few minutes left, but SARS-CoV-2, just for clarification, is the virus that led to the COVID-19 because it was discovered in 19 and led to things like social distancing, working from home, and all of these issues that just exacerbated the problems. But some sectors, the important thing in our study is that some sectors of society have been hit worse than others. And in our qualitative research, and I'll summarize that briefly because I know we won't have time to go into detail there, but I can summarize it quickly here, is that we, out of an N of about 335, we looked at, separated out Hispanic respondents, individuals who are of non-Hispanic Black origin, or Indigenous Americans and Asian populations, and analyzed those. And we found that they certainly were disproportionate to what we measured in the white population, essentially.
Great. Okay, next slide, please. And
Let's
then
just talk briefly about what qualitative research is. Certainly, we had our study looked at both qualitative and quantitative, and the qualitative research was designed to find out what people's lived experiences were, and it's been pretty much borne out as to matching what's going on in the most recent research we see today. Next slide, please.
so ours was interpretive phenomenology, right?
It was an interpretive phenomenology study. We looked at an N of 32 non-Hispanic Black, and like I mentioned earlier, Asian and Indigenous individuals. Without going into great detail here, next slide, please. Getting enough sleep, distancing, fatigue, all fell out as we analyzed the data using in vivo, by the way. And then we also, Mary Angeli also manually coded and looked at the factors that fell out of the study. Distancing, fatigue, small family gatherings, being able to even meet with family members for fear of getting COVID. And like Sri had mentioned earlier, the saddest part of this is at this point, we pretty much all know someone. I've had students that have emailed me, they lost a close family friend. So next slide, please. Hazard ratio is 95%. Go ahead, Sri, if you would.
Yeah, I just wanted to, quickly go through this. And this technique actually can be found in multiple places in various studies. But the idea was that we would look for various social factors that would be, and potentially looking at food insecurity and things like that. And some of the qualitative thematic analysis. So next slide, please. This is just methodology, going over more of it. So this is looking at a preliminary sort of geospatial distribution of some of the samples that we were able to collect all across the United States. So matching this now and taking this further a little bit and going through the zip codes that we collected and then relating this back to a data set of social vulnerability index and other social variables can be a very effective and useful way to conduct geospatial analysis on this data set. And so we're working on towards that and potentially disseminating some of that. And the next slide, please. And then next slide, please. Okay, great. So this is some of the results that have been actually presented. And so this was coronasomnia, looking at the fact that our sleep patterns, and not only is it anxiety, but our sleep patterns, once these have been kind of disrupted, we wanted to see is this something that is that has a kind of a leaves a permanent effect necessarily. So what we found is that, in fact, insomnia was a predictor for suicidal ideation during this time, and so the results were significant. If we can go to the next slide quickly. And so the results were significant. Individuals with sleep disturbances were found to be significantly associated with suicidal ideations. And the odds ratio was almost 4. So 4 times the amount of suicidal ideation. So, which is alarming because a lot of people, if you think about it, a lot of you in the audience may have actually experienced some sort of insomnia. So, it's really, really important to keep track of, our mental health and to make sure that we're getting enough sleep and some of the sleep hygiene and some of the other wellness types of things we're doing. Next slide, please. And so this was some of the findings looking at, these are percentages, by the way, and looking at anxiety in individuals that had COVID-19 in our population, in our study population. Definitely a lot more than individuals, first of all, in the total population versus, individuals that didn't have COVID-19. So this is really interesting.
And what's interesting, Sri, is with Omicron,
Yeah.
we're going up an exponential curve in the last month, essentially replicating this probably all over, right? Because your study was a little bit earlier, looking at a really quite slower growing kind of issue.
Yeah.
So one can only imagine that if this research kind of holds through time, that we've got an extraordinarily anxious country right now.
Yeah.
Omicron is incredibly transmissible.
Yeah, 1 million people a day are moving from your category on the left to the category on the right.
Yes.
Right. Unfortunately, yeah, that's definitely a good point and unfortunate.
Importantly, even if the death toll is lower, with the increasing number of people, the death toll is still going to continue. It's very sad.
As Amy
only about
Farrar
60.
Earlier,
oh, I'm sorry.
Yeah, as Amy Farrar noted earlier, it's just secondary and tertiary impacts of the pandemic in general. Now this 1 million people a day are now moving into a new category of risk overall, even if they're not dying in hospitals.
Yeah,
definitely.
If they can get into a hospital, they're all full.
Yeah. So just wrapping up, I guess, the next slide, please. And so I wanted to, I think. So just quickly in this, from this process, the process of actual grant writing, it's a lot more. In fact, it's a lot more than I can even explain, than either one of us can explain in a short amount of time. But it does require research gathering. It requires ideation. It requires analysis, and it requires dissemination. People need to know what you have done, right? So, you have to be able to use various methodologies. You have to understand various methodologies and what can enhance that. And mapping is one of those things. We can really get in to the community level to try to find unique solutions here. I mean, this endeavor kind of, we've been creatively trying to come up with solutions, and even in my conversations with Dr. Susubak in the Beacons of Light, at that point, there was so much that was not known, and even afterwards, a lot of real world solutions with real world problems. I think all across Walden, we've been trying to find solutions. So this type of information, I think, can help our students. Even, if we can decrease some anxiety in our students, that can actually improve student achievement, especially during during a pandemic era. This is an era. Okay, so next slide, please. Okay, so I guess, Dr. Z, did you?
This is just one of the studies that we've published on this so far. We've got more to go. We're leaning toward a one-word solution here, wellness. And in this particular study, I won't belabor it. It's available online.
Thanks, and I think it's a great way to to close out this session, I think my takeaway from being in many sessions today is with the social determinants of health conversation and others, that there's this emerging notion of wellness as a concept that might help integrate what we do across Walden as well. The social determinants of health is an interesting framework, but there's a larger wellness framework that might help us, you know, on so many fronts. So thank you so much for sharing your work. If there are, we've got just a few more minutes. If there, I'll give like a chance for one oral question if somebody wants to pop in. Otherwise, we'll wrap things up. Any questions from the floor? Hearing none, again, thank you so much for your work. Thank really to all of the teams that put great work together, that exemplify the kinds of leaders that you are and that we hope and expect you will continue to be as a Walden Social Change Fellow, because that's a title that comes with you now and into the future. We hope you'll help our new fellows as they come on board. We'll have a meeting sometime later in the year and bring all you guys together so you can help them learn about the experience. I want to thank Molly Lauk. Molly will be meeting with our new fellows, and we'll have announcements about our new fellows within a couple of weeks. Of course, she supported you directly as well in managing the financial aspects of the grants and everything. So Molly, thank you so much. And thank you for everyone who attended and provided such great questions, great feedback, some engagement. Julie Canepa, Kayla, the support team that really has been behind the scenes doing all this. We thank you so much. We're looking forward to this symposium being a yearly event as part of our first day of National Faculty Meeting kickoffs. And we're going to really push the recording here to get out to the Social Change Center's website and other places so that the general public can see the great work you all are doing. Thank you so much.